So the last treatment you need to know in this section is using the biological approach to treat OCD. If we think back to the causes of OCD, we looked at three. There was forms of genes, neural circuitry, and neurotransmitters. Now, even with today's modern medical technology, there's nothing we can do to change people's genes, and we really can't do very much about their neural circuitry. So the one option we have left is to look at the level of neurotransmitters in the brain, and that's what the drug therapy for OCD tends to focus on. So there are two broad drug groups which are used to treat OCD. The first one is antidepressants, and the second one are anti-anxiety drugs. Now, antidepressants include SSRIs, or selective serotonin reuptake inhibitors, which are used as a first port of call, and then if they don't work, tricyclics can be used secondly. And for anti-anxiety drugs, we have a group of drugs known as benzodiazepines, or BZs. Now, to think about how antidepressants work, we first need to understand what happens after neurotransmitters have been released across the synapse and the electrical impulse or the action potential has been transmitted to the postsynaptic neuron. Now, if you're still not sure about how synaptic transmission occurs, please go back to the biopsychology screencast and have a look over that again. It is fundamental to understanding how antidepressants work. So normally, once a neurotransmitter has done its job, it's reabsorbed by the presynaptic neuron, so it's basically ready to be used again. It could also be broken down by enzymes in the synapse. Now, what antidepressants do is they actually block the reuptake of the neurotransmitter, so it remains in the synapse and can carry on stimulating the postsynaptic neuron. Because of this constant stimulation, messages are more likely to get through, and that seems to be quite effective at treating the symptoms of OCD. Now, SSRIs block the reuptake of serotonin only, so it does what it says in its name. It's a selective serotonin reuptake inhibitor. Tricyclics work on both serotonin and noradrenaline. Anti-anxiety drugs work also on neurotransmitters, but in a slightly different way. So they work on a neurotransmitter called GABA, G-A-B-A, and what they do is they increase the effectiveness of this neurotransmitter. Now, GABA has a general quieting effect on the brain, so it reduces stimulation. So by increasing the effectiveness of GABA, you actually reduce the overall stimulation within the brain. Now, to understand how anti-anxiety drugs work, we need to first remember that an action potential is electrical, and therefore in order to stimulate an action potential, we need a potential difference. Now, a potential difference in very simple terms can be thought of as the difference between positive and negative charges. So if you've got far more positive charges than negative charges, then you're more likely to stimulate that action potential because there is a greater potential difference. Now, what GABA does is it attaches itself to the receptors on the outside of the postsynaptic neuron, so where neurotransmitters attach themselves. And what this does is it causes positively charged chloride ions to flow into the neuron, and that reduces the potential difference. So inside the neuron is negatively charged. You have this increase in positively charged particles, reduces the potential difference, and therefore means the action potential is less likely to be stimulated. Now, it's worth remembering that this is not something which is blocking or changing anything that would happen naturally. So we all have GABA in our brains. It always has this quieting effect. It has the effect of reducing the stimulation of action potentials. All anti-anxiety drugs do is increase what GABA does naturally. So you can read about both anti-anxiety and antidepressants in your pre-reading, and before you come into your lesson, make sure that you can name the two groups of drugs that are used to treat OCD, and also explain how antidepressants increase the levels of serotonin in the brain, and explain how anti-anxiety drugs reduce the overall amount of stimulation in the brain, thus producing less anxiety and less of the negative symptoms associated with OCD.